Hi. Hi everyone. Please join me. Actually, please join with me in live. I will just wait for 5 more minutes. So then we will start. About I will give a good framework about OET speaking because this is the first time I am putting live. Because it is very difficult for me to make a video regarding OET speaking or any educational video. Random video means it will be fine for me, but speaking or OET or NCLEX related or offset related videos means it is very difficult because I have to prepare for the video and I have to edit. So much is there. Yeah, if we are going for a live, it will be easy and good. So I can teach you as like my, my how I will teach to my colleague, like that I can speak. So anyone is there? See, please have it. Please do comment so that we will start our live section regarding OET speaking. Whatever I know, I will teach you. If you have any doubt, also you can ask me. So the basic is I have cleared my OET exam in December 2024. And I have got my OET speaking score is around 400 marks. I have got almost 350 plus. Yeah, you can comment if you if you can start means you can comment. I will just check my live once. Hello, hello Abhishek. I think you are the first one who's texting me. Just I will check once on my live. I have a doubt regarding my live. See, some people are telling like OET speaking is very difficult for us to interpret the cue card also. Basically, what I have felt was this is the when I am giving my OET exam. For me also it is I feel very difficult for identifying all the cue card and identify the clues also. So it's been 1.5 years I have finished my OET. Just a minute. Yeah, we will start within 5 minutes. Just give me 5 more minutes. So I'm planning to have our educational video like OET or NCLEX. So recently I have finished my NCLEX also. I'm planning to migrate in Australia. So I will give a self introduction of me because I'm working as a nursing officer in AIMS Mangalagiri, which is located in AP. So every state will be having probably one AIMS. Yeah, it's been 4 years. I have joined in 2022. NORSIC 2 I have joined. So it's been 4 years, and after 2 years I have started preparing for OET, and I have cleared my OET also, and now I have cleared my MPLEX. So step by step I'm planning to go from India. Just give me 5 more minutes. We'll start. Yeah, today I will give you a criteria about a basic criteria about speaking. So step by step I will give you how to interpret a cue card, and followed by how to speak each other. If you are speaking, or if I am start speaking also, if you are doing a card also, we want an opposite person. Like if I'm a nurse, one patient should be there, like which who will be doing the interlocutor also. So I am planning to have. Actually, my colleague had also finished their OET, so I am planning to do that. We both will do as a patient and caregiver. Yeah, it's mine. We will go. So sorry for the delay. So next time onwards we will start every Sunday 9:30. Yeah, 9:30 p.m. we will start. Okay. First thing, I have my note version. Yeah. So I have already told. I have already kept a video regarding a speaking criteria. So mainly in it will be held around for one one speaking card will have, yeah, um, so one card is for 20 minutes. Sorry, two card is for 20 minutes. Probably uh, your speaking session will be over within 20 minutes. So for one card it will take approximately 5 to 6 minutes, followed by a second card, and it will take around 5 to 6 minutes. Yes. Yeah. So this is the main thing. So we will be doing two cards for 20 minutes. Each card main content will be 5 to 6 minutes. So first is what are the criteria for a OET speaking? Criteria will be basically two types. First thing is linguistic criteria. Second one is clinical communication criteria. So based on two criterias, they will be assessed. So it will be around 0 to 6 marks for each criteria, 0 to 6 marks, and for this criteria 0 to 3 marks they will pay. So in linguistic criteria there are 4 topics. Which will be like first thing, intelligibility. Even though I have finished my OET, it is very difficult for me to pronounce intelligibility. Second thing is fluency, they will be assessed. Third thing is appropriateness of the language. Appropriate of the language. I will expand each and everything, what are the things they will be used to assess during this, all these criteria. And finally, resources of grammar and expression. So, in linguistic criteria, 4 things they will be assessed. One is intelligibility, fluency, appropriateness of the language, resources of grammar and expression they will be assessed. In clinical communication, so each one, so there are 4 criteria in linguistic criteria. See, linguistic means what linguistic means what we are speaking. So how our languages, how our appropriateness of languages, yeah, that's what I have told. Fluency, how intellectually you are speaking, and how you are using the grammar and slang expression, all these things will be assessed. What is clinical communication criteria? So in clinical communication criteria, this is nothing but how you are interacting with the patient. I will tell you, this is the OET for mainly for nurses. Okay, OET speaking for nurses. Please don't interpret with the doctors or dentists or pharmacology people. Yeah, clinical communication criteria. It will be for 0 to 3, and linguistic criteria is for 0 to 6. So if you are in intelligibility, in fluency, or in appropriateness of the language, if you are speaking correctly, if you are using all these criteria, for appropriateness they will give 0 to 6. They will rank 0 to 6. Okay. If you are good, they will give 5 or 6. If you are poor or you haven't used appropriate language, they can give 1 or 0 also. Okay. Yeah. So how much? 4. If you are performing well means 4 into 6, or either 4 criteria into 5. Either you will be getting, what is this? Solve 24 equal to 20, either 24. This is, see, in this itself you can fetch 24 marks. If your language is proper, you can fetch 24 marks. Okay. And then in clinical communication criteria, there are 5 things. I will tell you. First thing, how you are building relationship building. See, this is my first live. It is very difficult for me to write also. So we'll change. Relationship building. Each of the criteria I will be explaining you. See, if you are having doubt also, you can just tell me. Yeah. Relationship building. Understanding and incorporating what I don't say. Incorporating a patient perspective. Sometimes if you are well expert in English also, sometimes if you are writing words, you will be get confused. This is what mainly in my OET exam I have confused. And third thing is providing structure to the conversation. Okay. Fourth one is gathering information in an organized way. Okay, and fifth one is providing information in a organized way. So these 5 things they will be assessing clinical communication criteria. So each one you will get from 0 to 3 marks. So totally 5 criteria are there. 5 criteria it is there. So total if you are 5 into 3 means how much it is? 5 into 3, 15. Or if you are getting 4 into sorry, this is not. So if you are getting 5 into 4, so this is criteria, 5 criteria. You are performing good means you will be getting 3. If you are performing very poor means you will get 0, either 0 or either you will be getting 5 into equal to 0 marks, or you will be getting 5 criteria into it's moderate means you will be getting 5 marks. So this is the criteria. So this is the, see, while preparing for the OET, I'm sorry, I have been reading all the comments. So hello, please do your speaking like done this. Where is the app from? So I don't know what is the app. This is I'm using iPad. So what is the app? I don't know. I have first used a Note app. It's giving glare. So I have used a white background. So I will at the end of the video I will be telling you. I don't want to get distracted. Definitely at the end of the video, end of the thing I will give you. So I think this page got over. Okay. So see, this is the main criteria. Before doing a OET speaking, you have to be clear with this criteria. So how the it is like a blueprint. Randomly, you should not go for a the people who are getting coaching, no, definitely they will be knowing about this criteria because all the coaching centers will be using this criteria for teaching. So if people who is not using or coaching randomly they are studying for only speaking needs, so they are not, probably they will not be aware of this criteria. So I will, yeah, I will yeah. First we will go with the linguistic criteria. I will explain each and everything. First thing, legibility. Please don't mind about the spelling. So simply it is what is the meaning is understandable. How intellectually you are understanding the patient situation. Nothing but intelligibility is nothing but how intellectually you are understanding the patient situation. Okay, if you are understanding the cue cards, you will be easily. Cue cards will be very tricky if you are understanding easily or correctly. If you are understanding means you will be getting intellectual will be full mark. What is the mark? 0 to 6 you will be 0 to 6 out of you will be maximum you will be getting 5. And it is also mean intelligibility, like it should be understandable. Your language should be understandable. First thing is accent. First thing they will be as accessible accent. So what accent you are following? You should not use your no mother tongue. Okay, mother tongue should not be used. Mother tongue means mother tongue touch should not be come. So each and every people will be having their slang of using their English. So your mother tongue touch should not be there. Pronunciation. Second thing is pronunciation. Your pronunciation should be clear, audible, and understandable. Pronunciation should be clear, not blah 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 like that. It should be audible, medium tone you should have, and understandable. Okay, you should not talk in yourself, or you should not be so loud. And volume. This is a basic thing. Normal volume should be used. And pitch. It should no high pitch or low pitch. Moderate pitch. When I am when I am interpreting a cue card, when I am doing our role play, I will just tell you. And intonation. What does mean by intonation? Whenever you are telling your patient, example, Mrs. Chu, I would like to tell you that, or I would like to insist you, or I would like to make you remember that you have to be taken this medication correctly. Okay, it should be regular, not should be. You should take your medication correctly. Like that, you have to stress your when you are talking to your patient. Yeah, you have to. Whenever you are telling an important point, you have to stress. That is stressing somewhat, making the patient aware. Stressing some words. And yeah, this is about intelligibility. Second thing is fluency. What they will be assessing in fluency. Kindly, in fluency, main thing is please do not search for words. This is the only thing they will be assessing in fluency. And what I am saying is like that like that it should not be frequently, because you are having just 5 minutes of time. Okay, so is there any problem with the voice? Please everyone do comment. Maybe some network issues will be there, I think so. Just a minute. Yeah. I'm using my mobile data, that's what I think. Yeah, next time itself I will try to use my mic, because I don't have mic. I will buy a mic for you if you suggest. Yeah, if if any other people are having issue with my voice, please tell me. Let I know. Yeah, yeah, we will continue. Please do not search for that. See, that is the important thing regarding fluency. When you are, see, literally no, it is speaking, we just have only 5 minutes of time. In meanwhile, we have to finish our all these topics. So in that thing, if we are doing like this, means it won't work out. Your marks will be going for fluency. Okay. So third thing is appropriate. Appropriateness of language. So what is the main thing? Even though you are a nurse, do not use any medical terminology to the patient. They are a patients. They are a client. They are not. Even though the opposite person is a doctor coming as a patient, you should not use any medical terminologies. Okay. First thing. Second thing, avoid repetitions. Repeated words should not be used. What I am trying to say, yeah, I will give you one example. Mr. John, what I am trying to say is, you just have to take this syrup alone, which will having the volume of 5 ml. So you have used what I am trying to, Mr. John, what I am trying to say. Already you have used the sentence. And in next sentence, this sentence should not be used again. Next time what you have to use, Mr. John, what I would like to suggest is, or I would like to recommend is many alternative phrases are there. I will just tell you how to use different phrases. Okay. So avoid repetition, even the phrases also. Third thing is, use polite words. Like like what I can say. Yeah, I would like to kindly, please, if you have any doubt, let me know. Yeah, please excuse me. Sorry for the inconvenience. Like that you have to stop. Politely you have to come. And this is about appropriateness of the language. And fourth one is grammar. What is about grammar? Maximum, while we are using this role play, no, we will be using passive sentence only. Passive voices only we will be using. So passive voice maximum, at max we will be using passive voices. And try to avoid grammatical errors in words. See, mainly we will be starting with reading, simultaneously listening, then grammar classes, then writing, followed by speaking. This is the thing we will be doing whenever we are going for a OET speaking. So once if you are completing OET speaking only, means OET grammar only, we will be going for a writing or speaking session. Meanwhile, we will be finishing all our grammar, so you know how to use a grammatical sentence. And maximum we will be using past tense. Okay, this is about clinical communication criteria. Linguistic criteria. So just a minute, I will just come back.